Hey, everybody. Welcome back to the You're Not Broken podcast. Today, I have my friend on, Cynthia Thurlow, and we've just been chatting and not hitting record. So now we're going to hit record and talk about the gut, although other things might come up, such as the perils of book tours, the sexless lives of menopausal women, and what we all want to do about it. So welcome to the You're Not Broken podcast.
So good to be here, Kelly. And as listeners should know, we probably spent 15 minutes unpacking the lives of what happens during a book tour.
You're in the middle of book tour for the Menopause Gut, Balance Your Microbiome, Reclaim Your Health in Midlife and Beyond. The gut's very hot right now. Couldn't be more timely. I think 5 years ago, there would have been crickets for this book. And now it's hot, hot, hot. Can you kind of give us your overview of it's time to write a book about this because it's getting buzzworthy?
It's interesting. This is obviously content neither you nor I learned about during our medical training, because it's really been the last 5 to 10 years that all this proliferative amount of research has come out. What I think is really interesting, and obviously having a podcast myself, and I'm interviewing scientists and other physician colleagues and other experts, I was like, gosh, there's a lot of conversation about genitourinary symptoms and heart health and bone health and brain health. And yet I think really at the crux of all of it is this gut connection that most of us are probably not making the connections with, because traditional allopathic medicine is very siloed. And that is just the way the curriculum is taught. As I started to interview more experts and I started working with more women over the past 10 years, I was like, why am I seeing so many changes in the microbiome? Why is stool testing pretty consistent? Why are there consistent patterns of symptoms? And how does this all interplay with the gut? Like really thinking about the gut as a gut bone axis, gut brain axis, gut genitourinary axis, and how nothing exists in a silo, but really thinking about the microbiome as this main communication point, an inflection point for women in midlife. Like I'll make the argument that although it's super important that we talk about lifestyle, we talk about replenishing hormones, we talk about targeted supplementation, another part of the conversation really needs to be, what are the things that are changing in the gut that are exacerbating symptoms, and how do we address it? We don't yet have a primary indication for hormone replacement therapy for restoration of the microbiome. But looking at the research, I do think that is the direction things will go in. Like we will get an indication at some point, because if we look at the research on women looking at younger microbiomes, gut microbiomes versus menopausal microbiomes, restoration of estradiol, progesterone therapies, you can get a younger looking, in air quotes, microbiome composition that looks much more like a younger woman. So as we are losing hormones, it is so much more than just about bone, brain, heart health, genitourinary symptoms. There's a whole other world out there that we're not focused on, but I think it's another layer to supporting middle-aged women.
I love that. WHI. My listeners are pretty savvy, but I always want to kind of start at the beginning for some people. But so the WHI was heralded as this really horrible thing because the media did bad things with it. But there was actually a lot of good that came out of that study because it was massive and it was randomized, placebo controlled. But in the people who took hormones, they had an approximately, correct me if I'm wrong, 30% decreased risk of colon cancer compared to placebo. And this was not the first time this was signaled. If you actually go back before the WHI, there's also studies that show decreased risk of colon cancer compared to people who don't take hormones. And the theory being microbiome, gut's more able to heal itself, fix itself, find mistakes. And really, when saying kind of a way to wake people up is like when you're postmenopausal, you have the gut microbiome of a man. Men have more colon cancer than women do. And not to say it's bad, just to say it's different. And estrogen's protective, just like estrogen's protective, like you said, bone, brain, immune system, all of that stuff. And I think, when you look at the amount of colon cancer in the world, it's a top cancer. It's very common. Nobody ever talks about what they should do to prevent it, except for get your colonoscopies.
Yeah.
Right? Which we should all get our colonoscopies. But I think, it's crazy that if there was a drug that we invented right now that decreased your risk of colon cancer by 30%, it would have a Super Bowl ad. That is a massive cancer reduction, and nobody's talking about it.
It's so important because we're starting to see escalating rates of younger patients with colorectal cancer. And so I keep asking gastroenterologists that are on the podcast, what do you think are some of the reasonings behind this? And pretty consistently, they are saying, there's environmental, the ultra processed foods. and a lack of fiber in the diet. And so I really think that, you know, colonoscopy is both diagnostic and screening at the same time. And so there's a great deal of value to this. But when we start thinking about the threshold of and the implications of that loss of hormones, I think it is probably lack of fiber, ultra processed foods, environmental. And then I start thinking about like what's happening to the immune system as we're aging? What is happening with this baseline low level inflammation that is at the basis for nearly every chronic disease state that we start on? And I think for a lot of women, especially the women that say to me, you know, very persuasively, they're like, listen, I'm in perimenopause, I'm in menopause, I feel good. Menopause is a natural state. If I'm not having symptoms, why would I start HRT? It's helping them understand, like, you may not be particularly symptomatic, but smoldering beneath the surface is so much inflammaging and inflammation that it is staggering. So maybe at 45, 50, 55, you don't feel bad, but what are things going to be like when I hate this term, you know, when I did my training years ago, the senile vagina, but the osteoporosis, the cardiovascular disease, the neurocognitive decline. And then you think about the implications of a senile microbiome and all of the sequelae from these things. It's like, let's start educating women at a younger age. They know that it's like, it's not a question of if, but when it will happen. Menopause is a natural reflection point in the trajectory of our lives if we live long enough, but it isn't optimal. Like it's not
Yep, yep.
optimal to live without hormones.
And living to age 86 with 40 years without hormones actually is not natural on a
No.
societal level. There are always outliers. Just like Bill Gates became a billionaire without going to college. There are outliers. But most people who didn't go to college aren't billionaires, right? And so, like, this is very timely for me right now because my mother-in-law broke her hip last week. Yeah. And I'm the only medical person in my family. And so I'm on the couch, like, screaming dumpster fire to myself because otherwise I sound like a crazy person in the world of, like, the non-medical people. I'm like, "They're fine. Everything's fine. She's fine." And in my
Yeah.
head, I'm like, "Not fine. Not fine. Tripping on a curb and your hip cracking is not natural. There's nothing natural about going down 5 inches of an incline and your hip cracking." Right? And so I don't when you were saying, people are like, "It's natural, blah, blah." I'm like, just because you feel good right now doesn't mean that's the optimal way for the world to be. And number 2 is like, decline is slow, chronic, and progressive. It's not all or nothing until the hip fracture Tuesday,
Yeah.
right?
Well, I
Until
think
the
about,
colon cancer until the blah, blah, blah.
yeah.
And we're none of us are getting out of here alive. Like,
No.
I get it. Like, but let's try to be as healthy and resilient as we can. And I think we all want to be resilient. And when you think of hormones as a resilience tool, it starts making sense.
Yeah. Well, and I think about the fact that younger generations are being educated. I think about how my 18 and 20-year-old sons know what HRT is. They know what it is. They understand that women take this in perimenopause and menopause. They understand andropause because my husband and I talk about these things. So, like, younger generations are going to have a sense of what to expect. Whereas I think the boomer generation, which are my parents, there was so much shame and secrecy about aging. Like my mother told me she was 30 years old until I was 30. Until I finally said, "Hey
No,
mom,
she
you
did.
think,"
No, she didn't.
yeah, and I was like, "Mom, you think maybe like we acknowledge this is actually probably a little silly. Like, I mean, no one thinks that you are 30 years old. And obviously, if I'm 30, at some point you're going to hit your 50s. But my mom's generation never talked about their menopause experience. My grandmother's generation never talked about their menopausal experience. So, like, our generation is really learning a new way to navigate education and awareness and decreasing shame and secrecy, which is what I love so much about your platform, is helping women find conversations to talk about, which are should not be sensitive subjects, but can be for many. It's like, let's like talk about this so that people are aware of what options are available. And to your point about your mother-in-law, my mother-in-law 3 years ago fell and broke her hip. And then 2 years ago, fell and broke her femur on the same leg. And so she has not been fully ambulatory without a walker in 2 years.
Dude, I'm completely deviating from the gut. We need to go back. But on the topic of mother-in-laws breaking hips, because people need to know this. There is a JAMA paper published. It's the Step High study published in 2025. They did a follow-up paper that they just published looking at average age 73 hip fracture, frail older women. Testosterone versus placebo. The dose of testosterone was adjusted to have a lab value between 100 and 150. People would say that's on the higher end, right? So we're talking 5 milligrams, we're talking 10 milligrams, but adjusted to get them into the woods. That's very important in and of itself. And so they published it. It's a negative study, meaning their endpoint was distance walked in a 6-minute walk test 6 months after you broke your hip. Well, testosterone doesn't make me fast. It doesn't make you fast. So it doesn't make people fast, right? So, but in the study, women on testosterone at 6 months after a frailty fracture, 50% decreased risk of needing a cane or walker.
That's amazing.
Which is independently associated with living independently and mortality. Cane or walker after hip fracture is an association with mortality.
That's significant.
Ergo. So literally my mother-in-law's in the hospital and I send her the Step High study. And I'm like, please get discharged with some testosterone. They're going to think it's crazy. Just tell them that your daughter-in-law is like the premier testosterone female expert in the nation. And I'm sorry. But I'm like, if your mother-in-law has a 50% decreased risk of needing a cane or a walker at 6 months, and the medication is safe and effective and cheap, it seems like a no-brainer.
Well, it just reaffirms for me why I feel better personally with a higher free testosterone level. Like my integrative doc and I have these ongoing vibrant discussions. And he's like, but you're a little bit on the high side for free testosterone. I said,
Who
but
cares?
I feel better.
Yeah.
Like I think about sex. Like
Tell
whereas
him
when
Kelly
it's
says
lower,
it's okay.
I'm like, I don't
If you look at most of the testosterone studies, and even in the sexual health ones, these people weren't walking around with testosterones of 40. They were walking around with testosterones of 120.
We need to have, like, these conversations are vital because we still have clinicians that are prescribing so conservatively, just based off of this is where the reference range should be.
Reference range on Quest Labs is based off of 2 papers that are ancient. And I mean, to me, I'm like, I know all of this so much. Like I can dispute all of it. So Susan Davis came out with a paper 2025 that did about 1,800 Australian women, normals, right? And converted to American values. Once you're at a testosterone of 8, you're in the lowest 10%. Well, our normal values go down to 2 for Quest Labs. So you can be in the lowest 5 percentile and be considered normal.
Normal's not optimal.
Normal's not optimal. Okay, let's talk about the gut. When I was in medical school, we hadn't yet discovered that H. pylori caused stomach ulcers. Like, bugs were bad. We killed them.
Kill them all.
We killed them all. And now we think, fast forward, not that, like, I'm not 30, but I'm not that old. Antibiotic use in children is linked with like not great long-term outcomes. And they think it's because of your microbiome gets messed up. Yeah. And like, I saw this t-shirt. I don't own this t-shirt. I want this t-shirt. You should get this t-shirt for your book tour. And it says, my microbiome made me do it.
I love that. Yeah, I need to go find that t-shirt immediately.
You just get one made. It'll be good for the stage. But like the microbiome is more numerous than cells in our body because bacteria are smaller cells than human cells. When people are like, how's that possible? Makes serotonin, makes dopamine, makes likely things that help strengthen our bones. Bones have serotonin receptors on them. Like incredibly important. And then we just dump poison on them all day long.
Well, think about like when we are born, depending whether or not we are vaginal delivery or C-section, whether we are breastfed or formula fed, it's setting up the microbiome constituency. And we know there's like 3 key kind of deviations. Obviously, puberty, not surprisingly, pregnancy, if we choose to become pregnant, and then perimenopause. And you started the conversation talking about how women in menopause, our microbiome starts to resemble a male's, but that's not actually to our advantage. And so, part of the conversation is what are the inputs that dynamically impact the microbiome? And I think about alcohol. I think about antibiotic use. I think about proton pump inhibitors. I think about chronic stress. And you and I were just talking about stress, but even
book tours.
It's book tours. We'll just keep saying book tours. Like I told my husband 2 weeks ago, I was like, I woke up one morning and I was like, I must have hit a wall because I'm so tired. And he said, I'm glad you're human. He's like, I start to wonder.
Dude, I just in the last, like, very short periods of minutes, you are married to an incredibly insightful human.
I'm really, and I don't say this lightly. One of the best decisions I ever made was marrying Todd. Like full stop. I remember my grandmother telling me when I was 18, when you think you're 18 and your grandparents and your parents know nothing, she said, one of the most important decisions you will ever make. And she was very much a free thinking feminist woman. One of the most important decisions you will ever make is who you choose to marry. Full stop. And so I always say, you know, a lot of things have gone wrong in my life, but one of the things that went really, really right was when I met him and how great a human being he is. And just so he's like my biggest cheerleader, like the happiest, most positive human being you've ever met. And he's super
Todd.
smart. And he's super smart, which I always say, like,
That's
he's
sexy.
smarter than I am. It's a good thing.
Right. It's so unfortunate sometimes, but it's actually a good thing.
Yeah. I'm like, I think
It's good for
one
our
of my
egos to
no,
have
one of my family were like, "Marry someone smarter than yourself." And I was like, I didn't understand that, but now I'm like, yeah, yeah, absolutely. Marry someone smarter than yourself.
I
That's
love
good
it.
things for you.
I think definitely marry somebody who's, like, better at tech.
The engineer, I mean,
Yeah.
it's like just the way his brain thinks. I'm like, thank God you
I
can.
vote for the engineer as well.
Well,
I'm team engineer.
yeah, no, I'm married to an engineer. Oldest son is in engineering school. And I'm like, so smart. And just the way they think, very logical, rational, calm, cool, collected, and both socially adept. So there's that other side of it.
That's a nice combo. You don't always get that.
No,
Let's talk about how mouthwash is bad for our microbiome.
destroys your nitric oxide production. And so, like, how many people, like my father used Listerine every day of his life till he was no longer alive.
That's
I,
what you were supposed to do, and
right.
I feel like the dentist didn't lots of dentist listeners, and I love you, but I don't feel like they were like, "Okay, and now we're not gonna do that anymore." Like, it's
Yep.
kinda like mouthwash is like the vaginal douche of the mouth.
Anything that you put in your mouth, like chewing gum, like my
Wait, what's
dental.
chewing gum do?
Right, it can change the pH of your mouth, not in a
Really?
good way. Yeah, so, like, I was a prodigious gum chewer, so I was never a coffee drinker, and this is, like, probably TMI, but for years, I rounded in cardiology service, I would go into patients' rooms. In hospitals, you have unusual smells, and my, like, go-to was spearmint gum. I would chew gum, and little did I know I was eroding the pH level of my mouth, and so now I think very thoughtfully about everything I stick in my mouth, and is it contributing to, or is it making sure that the beneficial bacteria in my mouth are impacted in a negative way? Because we know the oral microbiome, vaginal microbiome, gut microbiome, et cetera, are all interrelated.
Yep,
And
it
so
all
you think
matters.
about cumulatively over time. So now I just don't even chew gum anymore. I'm just
That's
like, no
fascinating.
thanks.
I can't even imagine what vaping and smoking does.
Anything that's cutting, I mean, you're cutting off oxygen supply. I
Jeez
mean,
Louise.
yeah, really bad.
Nitric oxide, just for people who don't know, it's good for heart health, it's also good for erections, and women get erections, don't think you don't.
And actually you have nitric oxide signaling in the gut. So it actually helps with gut motility. So I remind people all the time that when women say to me, I feel like my food sits in my stomach. And if they're licensed medical professionals, the next cause of concern is like, oh my God, do I have gastroparesis, which is this, can be a side effect of long-term poor metabolic health, diabetes. And I'm like, no, it's probably you've got changes in smooth muscle contractility with changes in progesterone and with declining estrogen. You very likely have alterations in nitric oxide signaling, which means things don't move quite as effectively. So
Mhm.
it's not in your head. It is a byproduct of these hormonal shifts in the digestive system. So it's like added to the list of things that we need to consider for HRT. It's like, let's move stuff through our digestive system so that we feel like we're not bloated and constipated.
Totally. Fiber's the new protein.
Yes, it is. And it's the new F word because depending on who my podcast host
Really?
is, I've had some say to me, I would love to have you as a guest, but we can't talk about fiber. And I was like, why is that?
Oh,
Because
it's like a religion?
fiber is not necessary. And I was like, well, if you understood what was happening at a cellular level with this concurrent decline in hormones, you would understand why fiber becomes more important, largely because of this alteration in short chain fatty acids. So these signaling molecules that are produced when we eat fiber. So we eat fiber, goes through our digestive system, it gets fermented. And out of that come these short chain fatty acids and why they're important. They reduce inflammation. They help with insulin sensitivity. They're helping with mucus lining. They're helping with communication of the brain, like butyrate crosses the blood-brain barrier. And so as hormones are declining, we have less short-chain fatty acids. And this is one of many things that gets tripped off. So adding more fiber into your diet is actually beneficial. But the carnivores like to argue with me. I'm like, I'm not saying that you can't do a therapeutic carnivore diet for a month or two, but like long term, your body is meant to be omnivorous, truly.
It's kind of like the same argument that you don't need hormones after menopause. It's like, true, you'll live. It
Oh,
just might not be optimal, right?
yeah.
I think the lay population, the medical population gets this. We've done a bad job of translating it to the lay population in my analysis, because people will be like, how do I know I need it? How do I know I need it? And it's like, in the medical world, you only need something if you're like going to die in an hour, right? Like they need norepinephrine, they need oxygen, they need 2 units of packed red blood cells, right? Like that's what need means to like the medical people. And to the lay people, they're like, tell me yes or no. Is this a yes or no? And so I think the word need, I don't know, I've just been paying attention to this because
Yeah.
you see it a lot with testosterone. How do I know I need testosterone? And I'm like, well, technically nobody needs, you can castrate a man, right? Like nobody needs it in the life-threatening sort of thing, but man, it's a ad.
Yeah. Well, and it's interesting because a lot of my patients, they may not get the brain fog up front. They may not see alterations in lipids up front. They may not see changes in bone. But for them, especially for my thinner patients, they'll say, my vagina doesn't feel the same. Like I'm getting recurrent UTIs, or sex is just so painful. I don't even want to have sex anymore. And then they're like, okay, well, how do I fix that? I'm like, well, it's not to just keep prescribing antibiotic. It's
No
actually
shit.
something fairly simple. Ask me how many of my cardiology patients were on chronic low dose antibiotics. Like it was a running joke between that and the benzos, like Ambien, Ativan, Valium, of a certain age group. But I think for many women, that's like the first sign that there's probably something changing hormonally enough that it is compromising their quality of life. They may not even think about the other things yet.
I'm seeing this a lot with GLP-1s because the media is loving this with the GLP-1 vulva and vagina. I'm like, if you're losing, first of all, if you're starving, because there's some starving happening. If you're starving, all systems are like triage,
Yeah.
right? Pelvis, cut it off,
Yeah.
right? Like batten
Don't
down
even
the
damage
hatches,
that.
right? So first of all, starving. But second of all, if we're losing body fat does create an inflammatory, crappy estrogen product, not the estradiol, right? But they are becoming more hypogonadal. You need vaginal estrogen, you need vaginal DHEA, you need all of that. And so like, but to blame the GLP-1 as like it's a medication side effect, that means you're not actually understanding the pathophysiology of why this is happening.
Well, there's so much fear mongering that goes on that I think on a lot of different levels.
Cynthia pauses for a large sigh about
No,
society.
it's like whatever the clickbait is, it's whatever the fear mongering statement can be, and then it just frightens people into potentially not getting the help they need. If someone was talking about the GLP-1 vagina and how now people are looking to get vaginoplasties because
Ah,
things are changing, and I was like,
ah.
let me tell you something. I've had 2 C-sections. That's as much attention as I want to that part of my body. But if a woman is deciding on her own that this is something she's pursuing, great. But to somehow suggest that women now need to have a vaginal overhaul because they've
It's
lost weight.
predatory. It's
Correct.
predatory.
Correct.
To me, I'm like, listen, a lot of people look at your face. And I could argue you make money off of your face. I think your face is distinctly different from your pelvic structures, which maybe 1, 2, 3, however many partners you have might be looking at it. And I guarantee you, they're just happy to be in the room with you. Right? So to me, I'm like, you're going to take $10,000 to rehaul something that, like, are you making money off of this? Some people are. There's videos you make money off of.
Yes.
But most people aren't, right? So to me, I'm like, you're going to do $8,000, $10,000, revamp a vagina that I'm sorry, girlfriend, you don't even know what's normal in the first place. Where can you
Very
find
true.
normal on the internet? And to be like, don't worry, girlfriend, you're normal.
I think
right?
it's as bio-individual as we are as individuals. Like, I was getting a facial one day, and this lovely anesthetician, emphasizing she's an esthetician, she mentions to me she also does vaginal laser therapy. And so out of curiosity, I started asking her questions, and I was like, "Talk to me about your training and talk to me about women that come in to see you and what they're doing." And
Does she know who you are?
no.
Okay, you're like a secret shopper.
Yeah, no, I literally was like asking all these questions. I was like, "This is fascinating." I went home and had a whole conversation with my husband, and he said, I know how you think about things, like laser on your face. I'm going to a licensed medical professional, no questions. But how many women are getting a facial and then very innocently they're told that there's a vaginal rejuvenation laser that this anesthetician can use legally? And I was like, hot laser in a sensitive body part. I think that's a hard no.
There's a very limited role for it that is only good when combined with vaginal estrogen or hormones. Otherwise, you can burn people, especially if they're very pronounced atrophy.
Atrophy. Yeah.
But I see all the people who spent the $8,000. It didn't help my sexual desire. Well, no shit, it didn't help your sexual desire. It's not supposed to help your sexual desire. It's not what it's designed for. It's a laser, right? So they go in thinking it'll fix a problem that it was never designed for, and you're out a ton of money. So I think it's predatory
Yeah. I mean, I think
in a lot of hands. Not all, not
I mean, and I think it's a part of a larger conversation because I think as women are aging, I think even the most confident, well-adjusted human beings, like the aging process can just be a little overwhelming depending on the day. To your point about predatory practices, a woman's assuming if she's going to someone who utilizes these strategies that they are looking out for her best interest. Like really the way that that should be discussed should be like fully informed consent. Like what are you looking to have improve, and can this modality help? Because if it could, great. But if you have a problem that really is at a cellular level, a loss of hormones that drives pH changes, that sends epithelial line changes, so it just becomes a bigger conversation. It's like, well, that laser is not going to fix what really is a hormonal deficiency problem. And
yes,
really what you need is the, $10 tube of vaginal estrogen. Thank you
yes.
very much.
Do you know that there's a paper that women who use vaginal estrogen have less rectal cancer?
Really?
Yeah, I'll take that in your microbiome book about the
Hey,
gut.
well, this is probably TMI, but like when I use my stuff, I do clitoris to anus.
Yes.
And I'm
C,
like,
C to A.
yeah. I mean, these are the conversations like women need to hear this information. I think I had a woman say to me recently, well, I lost my applicator. I don't know what to do. And I said, well, you can use your
You've got 10
right.
attached to your arms.
Right. It's like actually toss the applicator and, up to the like your first or second digit, you can
Yes.
do a better job internally and externally using your finger. And you know your body better than that applicator, which is plastic and,
A lot of
unidimensional.
yeah, totally. I people just don't have time to learn how to do it properly, and I think that's when people are like, it didn't work for me." Is like, hormones work.
They're
Sometimes you
very
might
effective.
they're very, very effective. Cells are like, "Oh, estrogen." But, like, sometimes you need an androgen, sometimes you do need DHEA, sometimes you need it on the vulva if that's where the pain is. Let's talk about SIBO.
Small intestinal bacterial overgrowth.
Talk to me about that. SIBO wasn't a thing, then it's a thing, then it was everything. Now people are like, "Is it real?" It sounds like it's real because we're talking about, like, microbiome good, but then we're like, "But too much bugs in the wrong place, not
Yep.
good."
Yeah. So when we're
So
talking about the gut microbiome, we're talking about the large intestine or colon. So obviously farther down the digestive system. When we talk about SIBO or SIFO, so small intestinal bacterial overgrowth, small intestinal fungal overgrowth, we're talking about bacteria that should be isolated in the colon that have crawled up into the small intestine where they drive a lot of symptoms, gas, bloating, discomfort. And it's never that you just suddenly develop SIBO or SIFO. It is usually a sequelae of other alterations in the gut microbiome. I've experienced it. Thank God I got rid of it. It was not pleasant, but it was a latent Giardia infection that just threw off everything in my digestive system. But I think for a lot of individuals, number one, there are clues on standard stool testing that I can see that kind of send me in the direction like I don't think we necessarily need to we need to actually test for SIBO, but there's enough gas, bloating, digestive issues, and looking at the integrative medicine stool testing that will give me a sense this might be what we're dealing with. But it's people that will say things like, I wake up in the morning, my abdomen is flat. I go to bed, I look 6 months pregnant. Or I eat one meal and I bloat out like it's so significant. And let me be really, really clear. New onset bloating, New onset bloating, digestive changes, constipation, diarrhea, etc., needs to be evaluated. Thing that you just willy-nilly wing it. In fact, oftentimes I will send a patient to go to GI first and say,
Yeah.
let's just make sure
Rule
there's
out the bad stuff.
right. Rule out the bad stuff. Let's make sure there's nothing else going on because sometimes bloating can be like a late sign of ovarian cancer, which we know is, or even uterine cancer, which is something that we want to be mindful of. So if we rule those things out, then it gives us time to play around a bit. But I think for a lot of individuals, it's helping them understand there's a place in the large intestine or colon where the microbiome, those bugs should reside. But if they start creeping farther up the large intestine into the small intestine, you can have a lot of these magnified symptoms on top of everything else that's happening when we're transitioning from perimenopause to menopause. It is a real thing in my estimation. I think in most instances, by the time someone gets to me, more often than not, they've already seen one or two providers. They don't feel like they've had resolution of their symptoms. And I'm like, there is a very stepwise approach to addressing digestive symptoms, in my estimation. And it's why I always say if SIBO doesn't happen overnight, it's not resolved overnight. It doesn't mean that every single person has to be on these really restrictive diets. It's more about addressing the underlying deficiencies. Is it because you don't make enough hydrochloric acid anymore? Do you have enough digestive enzymes? Do you know that as estrogen is declining, it impacts bile acid synthesis? So suddenly women can become fat malabsorbed. They may have more steatocrit, which is fecal fat. They may say, oh, my stool looks really greasy, lying on the top of the surface. And certainly for people in kind of our field, we talk a lot about poop, but for a lot of patients, they're like uncomfortable, embarrassed. They're like, don't talk about sex and sure as heck don't talk about poop. That's really embarrassing. But I think it's a way to kind of get a sense. So sometimes digestive support can improve and ameliorate symptoms. Not every bit of bloating is necessarily SIBO, but it can happen. I would say maybe 10% of my patients are experiencing it. It is a real thing in my estimation. SIBO is less common. If you've got fungal overgrowth, there's a whole lot going on. That's a whole separate.
You've breached a lot of defenses to get
Yes,
to that point.
exactly. Exactly.
GLP-1s helping bloating and inflammation. I've
I'm
seen
a
it. I've
huge
seen it.
proponent. I'm a huge proponent. I know that the word microdosing and personalized dosing can be triggering to some individuals, so I want to be sensitive to that. I think that there is no other drug in my lifetime that will have as much of an impact as GLP-1s. And I think from the perspective of we know that it is altering the microbiome, improving insulin sensitivity, reducing inflammation. I've had patients that have autoimmune conditions. They're put on a GLP-1 and all of their symptoms go into remission, not just the inflammatory life, which is so frustrating for women. It's, hey, not looking to be back to a size zero. I'm just trying to not feel like myself and not have all this inflammatory weight gain, less visceral fat. I'm a huge proponent, but I know it can be very incredibly triggering depending on who I'm talking to. So I always like try to respectfully say, this is my opinion. This is what I've seen clinically. I'm a huge proponent of them. Not just to mention, like Kelly, for so many women that say to me, I didn't think I drank that much. And they're on tirzepatide. And because they've got a suppression of these like dopaminergic signals and cravings and desires, they're drinking less or not at all. They don't have a desire to snack. Suddenly, occasionally people will admit, oh, occasionally I like to smoke pot. Now they're like, I don't even want to think about that. They just all these, whether it's a shopping addiction or, whether it's someone who's looking at porn too frequently, people are just saying, I just have no desire to do it. There are so many implications that I'm hearing from addiction specialists and so many other specialties that this is why I feel very confident saying this is not just a weight loss drug. It is way more sophisticated. And I think that at some point, most, if not all of us, will be using it in a targeted, prescriptive way.
Yeah. I've become much more, is bullish the right word? Bullish about it because the stories that when women come back and they're like, my bloating's all gone, my cardiac numbers are better, I feel like myself again.
Lp(a) went down a bit.
That's bullshit when they say it's genetic and nothing moves it. Does that piss you off? Because I'm like,
It does.
estrogen supplementation decreases it by 20%. Stop saying it's immovable and it's a fixed genetic. And the
Yep.
other thing is, I'm going off on a rant because you gave me an opportunity. People are like, check it once. They're like, check it once. And I'm like, if you're a man, But it can
I mean,
change when your hormones go down, and it can
yep,
change when you start on hormones. And so
yeah.
this whole thing of like, it's just a genetic fixed risk factor is actually bullshit. And it pisses me off that when people say that.
Well, and it's interesting. I've had Tom Dayspring on the podcast like 9 times, and he's become my buddy. And he's just this incredible lipidologist who myopically focused on women in menopause. So, like, he's just a wealth of information. And he said, Cynthia, do you know that estrogen is a weak PCSK9 inhibitor? So these are very expensive drugs like Repatha. Yes. And so when he told me that, I was like, "Oh my God, why are not more women?" 20% of the general population has elevated Lp little a, 50% of African Americans. Why are we not screaming this should be yet another indication for estrogen therapy? Now, obviously, if you take oral estradiol, you'll get a better response than transdermal, but heck, anything is better than nothing. My Lp little a is high. That's genetically, but I can improve that. And so with a little bit of a microdose of a tirzepatide and estradiol therapy, it's gone down. It's not perfect yet, but we're kind of trying different things. But I think
Don't measure it. Don't measure it on your book tour.
no, oh God, my functional med doc was like, did you get your hormones tested? And I said,
We're
we're
not
not
doing that.
testing my cortisol right
We're
now.
not doing
You would
that
be
right now.
very unhappy with me.
Right, right. I want book tour on the books. We can't have this recorded. This is a temporary problem.
No, I literally was like, at some point I will be on vacation in June, and this will be a pleasant rearview memory
Yeah,
of the past 6 months.
yeah, exactly. So except for the hardcore carnivore people, which they can have their own thoughts. And truthfully, I believe like everybody's diet is uniquely what works best for them. I think at some point in the future, we'll be able to like test you and be like, you should probably be 60% meat and blah, blah. Like we don't have that yet. But my point is, do you think beans are like the absolute best food?
I think it's a great source of soluble and insoluble fiber.
I'm trying to figure out how to get more beans into my life.
Yeah, I mean, here's the thing, like, I tell
And protein though. Like it's fiber and protein.
well, and here's the thing, I'm
And it's
like,
filling.
omnivorous diets, like, when I go to Cava, double protein, so double chicken, double steak, and then I do arugula and lentils. And so I get a little
Delicious.
bit of plant-based protein, I get a little bit of animal-based protein. To your point, when a woman tells me I do not tolerate any fiber, I'm like, "Oh, your microbiome needs some help." And as someone who in 2019 was hospitalized, got a lot of antibiotics for 6 weeks. My microbiome was decimated. I was full carnivore for 9 months. So I see the utility, but I think we are designed as human beings to be omnivorous.
And adaptable, maybe?
Correct. And so
Yeah.
I think, I eat quite a bit of fiber right now, but it's taken 7 years. Like, transparently, I would just share that you can work your way up. I think for some people, especially if they've, been treated for cancer treatment, or they've been on a long, appropriately dosed antibiotics, whether they had tick-borne illness. My husband just got treated for tuberculosis. I'm not kidding, in 2025.
In
Yes,
America?
in America, because he's traveled to some pretty unusual places. Yeah, it was very strange. So 6 months of antibiotics they did dot therapy, came to my house every day. We were the only
Whoa.
people in the entire county. Yep. In the midst of me writing the book. And I only interject this to say, like, the things that I'm making my husband do in terms of like fermented foods and cycling, probiotic rich foods and probiotics. I mean, just the amount of things that we're hitting him with to help restore the microbiome because it's been decimated. So the point being, I think there are times in our lives where we're more or less amenable to fiber intake, but I think the point is always track and just eat more. So let's say standard American diet, you're consuming 5 to 8 grams of fiber a day. We want to be consuming more than that, but you can't go from 8 grams to 50. Your microbiome needs time to acclimate. That's like, you don't run a marathon by just putting on a pair of shoes and running a marathon. You build your way up. So we're building up the microbiome to be able to tolerate more fiber. And I think there's a bio-individual approach. Like, Kelly may do really well with beans, and maybe beans don't do well with me. So I think that there's a degree of experimentation. There's so many options, and it's not just eating salads. Common misconception that that's the only way you can get fiber. And I'm like, flax and chia seeds, like, that is my go-to when I'm working with someone who says, I don't tolerate a lot of fiber. 1 tablespoon of fresh ground flax and chia seeds, not only will it help with a little bit of plant-based protein and fiber, but help you poop. And that's another thing that,
Love a good poop.
it's so important. Just like babies. Babies need to sleep and poop. As adults, we need to sleep and poop. We're simple beings.
I love that. It's a great place to end. Some people say if you don't tolerate a lot of fiber or you feel bloated with it, water, water, water.
I think hydration is important, but it could also be quantity of what you're consuming. So if someone's saying, I think I might be fiber resistant, it's like, okay, don't eat a can of beans. Try a couple tablespoons. Don't eat, raw broccoli and cauliflower, which I hate, by the way. Maybe you roast it lightly. So it's as you're breaking things down enough so that it's more easily digestible. And maybe you need some digestive enzymes. Maybe you need a little bit of TUDCA. Maybe you need some hydrochloric acid if you're eating more protein. I think there's a lot of ways to address it and do it from a very bio individual place. You just have to be open to the possibility that you need to experiment a bit.
Love it. You are so smart. Thank you for writing this book. Thank you for talking to us about poop.
Thank you for having me.
Any final word of wisdom you want people to know about their gut?
So here's the thing, your microbiome is incredibly dynamic. So small changes that you make today do ultimately lead to a big impact. So don't think from, hearing our conversation like, oh my God, I have to overhaul everything. No, no, something as simple as 4 to 5 deep breaths when you sit down to eat a meal can get your body out of fight or flight into the parasympathetic, where your body can assimilate, absorb, digest, and detoxify. Something as simple as taking a 5 or 10 minute walk after a meal can help regulate your blood sugar. It can be good for motility in the gut, which definitely changes as we are navigating a decline in hormones. And then lastly, like experiment, go to the grocery store, try something new. Like we really should be consuming 30 plant varieties a week. And I know that freaks everyone out, but I'm like, listen, you can make a big salad or you can make a big smoothie and throw a bunch of things into it, but just be more thoughtful. Like don't eat, like I always say, monogamy is good. Food monogamy is not ideal. Like, we do want to have some variety in our diet. Like, it really is that important. So just be thoughtful about what you're doing. It really does make a big difference.
Love that. That's great advice, and it's small stuff. It's like, throw away the mouthwash, put some flaxseed in the smoothie, like, little, 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 and then
Yeah.
all of a sudden you're a lot healthier than you were a year ago.
Yeah. Get a squatty potty if
Get a
feel like
squatty
it.
potty.
Get a
We love
squatty
those.
potty.
Yep, absolutely, that's a great one. Alright, my love, hang in there on your book tour. I'm proud of you. Keep it up. Thanks for
Thank
being
you.
here.